Hi there, I'm Dr. Chung and welcome to your friendly proctologist. Thanks so much for being here. This video is an instructional video for my patients undergoing surgery with me. And I'm going to go through the preparation instructions that you need to make sure you do or be aware of. If you're not having surgery with me, this could be an informational video for you as well to help you on your surgery journey, or I hope you get something out of it. But let's get on with this, shall we? So I give everyone a instructional sheet here, and we're going to go through the day before surgery and then the day of surgery. So let's, for example, say that your surgery is going to be on Monday. So the day before surgery is Sunday. What do you do? And I have the first thing written down. There are no restrictions. You can do whatever you want. Go where you need to go. Eat whatever you want to eat. Drink whatever you want to drink. And your diet is not restricted. So if you want to have a steak, you want to fast, whatever your preferences are, maybe you want to keep it light. That's a-okay. The next thing I tell people to do is to take a cap full of Miralax with your breakfast on Sunday. And the reason for that is because we want your stools to be soft and also to keep moving forward. All the medications that you get from the surgery and the pain medications will slow you down and constipate you. So we're trying to counteract that. If you take a Miralax bottle or the generic Miralax, you'll unscrew the top, you'll flip the cap over, and you'll see a line at the top of the cap. That's where you want to fill it to. So you'll take the powder, fill it into the cap, and then you'll put that powder into whatever drink that you want, whether that is soda, juice, water, coffee, food. I suggest you take it with some meal because it's going to turn into your poop at some point, right? And that way the Miralax is going to be moving through with that. So we're going to be continuing the Miralax through your recovery, and so you want to keep a bottle handy. The next thing I say here is don't eat or drink anything after midnight. And really what I mean is don't drink anything or eat anything 8 hours prior to your surgery appointment time. The reason for this is for your benefit and your safety. What happens is if you have food in your stomach or drink in your stomach, when they put you to sleep, some people involuntarily throw up. That stuff can get into your lungs and people can die from that kind of pneumonia, that kind of infection that occurs after that. So it's not for the surgery center benefit, it's for your own safety. The people at the surgery center and nursing staff will ask you when was the last time you had to eat or drink anything, and you need to say that you've had nothing for 8 hours prior. Okay? The next thing, supplies you may want. So for sure I recommend 4x4 inch gauze, and that's 4 inches by 4 inch square gauze. It does not need to be sterile, it just needs to be in the package. You're going to be getting drainage like poop stuff, blood stuff, drainage stuff, and you're going to change that out every 2 to 4 hours. So it does not need to be clean, it's just going in the garbage and it's collecting poopy stuff anyways, okay? Amazon stuff is okay. I recommend you get a big bag of it, like at least 100 gauze for sure. Next, you want to get moist wipes. For obvious reasons, cleanups are easier. They're a lot more gentler that way. If you want to get a special soap, I recommend a hypoallergenic soap like Dove soap bar or Dove liquid soap. But you don't need to get any special soap. Just use the same stuff that you're using now, no problem. Get a bottle of Miralax. We want to use this and continue it through. I don't recommend just Colace or the doctors say it's just a regular stool softener. Why? Because it doesn't have that pushing forward effect. For many people, it just does not do the trick. Okay. Lastly, the Fleet Enema. And this is going to be used on the day of surgery so that you can clean out your bottom end and so I can do my job and see everything I need to see. So definitely also pick up your prescriptions that are prescribed for you. So in summary, day before, on Sunday, your surgery is Monday. You can do whatever you want on Sunday, eat whatever you want. Make sure you stop eating and drinking 8 hours prior to your surgery. If your surgery is on Monday at 6 a.m., Sunday 10 p.m. is your knockout time, or the time where you stop everything, okay? And get your supplies and prescriptions so that you're ready for surgery day. Now it's gonna be the day of surgery. You wake up early on Monday because your surgery is at 6 a.m. You need to arrive by 5 a.m., 1 hour prior to your start time. And then you want to get something else done, like your enema. Okay, so is it okay to brush your teeth? Yeah, as long as you spit out the water, no problem. No swallowing water, please. No coffee, no juice, no gum, no candy, nothing. How do you do an enema if I've requested that you do that for preparation? I first recommend you do it close to a toilet. Do it in your bathroom. You can do it on your hands and knees, or you can lie on your side. The tip is lubricated, it is soft, and you want to insert that into your bottom end about 1.5 inches, okay? Once you put that in place, gently start squeezing the bottle. You're going to feel something cold. You're going to feel something filling, and therefore it's going to make you have that urge to go poop. Allow that sensation to keep growing until you can't take it anymore, like you're completely full down there. Once you get to that point, throw that bottle in the garbage. You no longer need anymore. But don't go to the toilet yet. Wait longer until you can't take it anymore, okay? And then once you get to that maximum point, then run to the toilet and have the bowel movement. I guarantee you're going to have more than one. Usually it's going to be about 3. And so you want to wait and have the time to do all that. So I recommend people start the enema thing at least 1 hour to 1.5 hours before you get in your car. Because if you do it too late, you're going to have a bowel movement or accident in the car, and it's not going to be pleasant. So make sure you wake up early enough to do that, and then arrive to the surgery center 1 hour before your 6 o'clock start time, okay? And I have the address, the phone numbers, there's plenty of parking to get to the surgery center. And in summary again, day before, don't need to do anything, no eating or drinking 8 hours prior to your surgery. Get all your supplies and start the Miralax on Sunday. On day of surgery, wake up really early so you can do the enema 1 hour, 1.5 hours before you get in your car. Then arrive to the surgery center 1 hour before your start time, so 5 a.m., so that you can be on time and ready for your surgery at 6 a.m. Well, I hope that was helpful for you. If you have any questions at all, always ask me, call me, text me, whatever you feel is comfortable or whatever, depending on the type of situation, if it's an emergency or not. I'd rather get all the issues handled and questions and issues ironed out so we don't have any hiccups as best as possible. Thank you so much. Bye-bye.